Hello, I'm Dr. Michelle Jorgensen, and I am so excited to have you come visit. This is my office. This is Total Care Dental, and this is what you're going to see when you come in. I wanted to walk you through a shortened version of what you can expect during your first visit because, as you'll see, this is very different from any dental visit you have ever had in the past, and I want you to know what to expect so that when you come, you're comfortable, you're relaxed, and you're enjoying your visit. So the first thing you'll see is a happy, friendly, smiling face sitting here at the front desk. She's not here today, but she'll be here when you come, and she'll usually greet you by name even though she doesn't know you. Come on back. Let me show you some of the things that we do back here as we're working as well. So one thing that we pride ourselves on is we are an award-winning customer service office. Now, I know that that's not something you typically hear about from a dental office, but we actually won Best in State over all kinds of consumer services. Things like Ken Garff Automotive, Little America Hotel. We beat them out in customer service. We're kind of proud of that. And the reason is because we like to take care of you when you come. So one of the things that we always have is a refreshment bar. We have healthy snacks because we're into healthy things. So we have naked smoothies, Lara bars. We usually have a variety of different things that are here for you to enjoy because when you're done with a dental visit, sometimes you're hungry. Sometimes we're hungry. So we always want to have some good choices to eat. These are our offices where some of my team members will stay during the day, and they're always happy and willing to help you with any questions you have and anything you might need. As you go down this direction, the first thing you'll see is some pictures on the wall. These pictures on the wall are all Total Care Dental patients that have had visits just like you and have been very, very happy with the care they've received, and we're sure you're going to feel the same. The first few appointments or first few rooms that we'll pass here are actually the rooms that we use for your preventative or what we call your wellness appointments. So those are the places that you'll meet with our hygienists. First visit, you probably won't spend a lot of time there. Now this is someplace that we are going to stop during your visit. This is our CT machine. CT stands for, or you probably heard it termed as CAT scan before. We do this for every new patient because you cannot believe the things that we're able to find on a CAT scan that traditional dental x-rays don't show. And we're also very proud to say this is all digital, so the radiation is extremely low from this machine. Very different from what you'd get from a typical hospital CAT scan. And it's very dental specific. We also will possibly, depending on what you share with us during your interview, we may have you stop in the restroom on your way back. And I'm carrying around this heart rate monitor, which might seem like a strange thing to do in a dental office, but we believe in a test that shows me a lot about the way your body's functioning. So depending on what you share with my new patient coordinator in your interview, we may have you stop in the restroom and put this on your way back. So I wanted you to know that because this goes underneath clothing. So make sure that you're wearing something loose and comfortable, that you're able to go in the restroom and slide this underneath clothing. It has to go against skin right about here. So we help you size it, and then you go and put it on in the privacy of the restroom. I just wanted you to be aware of that in case that's something we stop and ask you to do on the way back. So let's keep continuing back here. These are the rooms that our doctors work in during the day. So usually when you come, you're going to hear a lot of busyness going on because we're a very busy office. But everybody's always happy and smiling and welcoming you as you come. Now this area over here is not very exciting. This is what we call a sterilization area. But you know what? For us it is exciting because this is the area where we keep you safe. So these are the things that we do to make sure that your visit is very safe, very clean, very sterile, and everything that you can trust and rely on. We're going to continue on down this way. We give you a complete tour of the office when you come in as a new patient because this is where we do the magic for our new patient visits. So we always have you stop first and we do photos of you. Everybody doesn't like photos, but you know what? It's just part of the process and everybody gets to do it. So we're going to do photos of you, and then this is the new patient suite that you're going to spend most of your visit in. We've tried to make it as comfy and cozy as possible while you're here. Obviously, we know people, the most favorite place is not the dental chair, but we've tried to get it more comfortable. We have lots of pillows and blankets and things, so if you're cold or you need to be warmed up or need support for your back or your knees, anything, we have lots of things to help you with that. Now, while you're here during this appointment, we're going to be doing a lot of testing. Now, this isn't crazy testing. These are just simple things like we're going to be taking your blood pressure. We're going to be testing your pH, the pH of your mouth. We're going to be testing whether your teeth are alive or not still. We're going to be checking whether metals in your mouth have what's called galvanic reaction. Just a lot of things like that. So again, I wanted you to be prepared because make sure you're wearing loose clothing, something we can slide a sleeve up on so we can take your blood pressure. You'll be standing and sitting, so make sure to let us know if you have any issues with that, and we'll help you. We have ways to accommodate that. We do a lot of, like I said, a lot of things. A lot of those things over there that you see are for that. And then we also are able to display everything that we found during your visit on large screen. And this is perfect for you and I, because we sit and we just talk together about what we find. So that's the majority of what your new patient visit will entail. Now, people will always think we're crazy when we say plan on 2.5 hours. It's really true. Plan on 2.5 hours. If we can speed through it, we will, but we don't want to shortcut your time. So plan for it and enjoy it, and then get a smoothie and some snacks on your way out. Now, when you're done, you will step into our consult room with your treatment coordinator. You're going to be meeting your treatment coordinator that day, and you'll step into the consult room with the treatment coordinator. This is the place that feels a little homier, and in this room, you get to discuss what's next. What your next appointment is, what you're going to do when you come back next time, and usually it's to come back for a planning appointment, because when we spend 2.5 hours with you gaining information, I need a little bit of time to process all that and to figure out exactly what the game plan for you is. Sometimes if you have very simple needs, we don't have to go to a planning appointment, but most often we do have a planning appointment. So usually you spend a little time in here getting to know your treatment coordinator and then scheduling for your planning appointment. Hopefully that helps. Hopefully that takes that nervousness or anxiety edge off of what's going to happen during your dental visit. I can't wait to see you soon.